assalamu alaikum everyone. This is Sana from Dramalogue, and I'm joined by special guest today, Dr. Huma Qureshi, who's a psychiatrist from California. Hey, assalamu alaikum. How are you?
Walaikum assalam. I'm good. How are you? Thank you for having me here.
Sure. So we just wanted to talk about mental health portrayal in the Pakistani dramas and how it is not done right or done right, or any stigmas that can be broken, or any breakthrough barriers that can be reached. So Homa and I, we the way we met was we were discussing Pakistani dramas, and then we talked about a drama named Ghair, which was just aired recently, maybe like a few months ago. It is written by Zanjabil Asim, and it had again like a depiction which was totally trivialized, and I was discussing with her, and so basically in the drama what happens is that the girl, one of the girls, who's initially she was the love interest of the guy, of the male lead, but then the male lead ends up getting married to the other girl, and this other girl becomes like the bad girl, I guess. And then in order to get the guy, her popo tries to tells her to take a few pills, and which will make you unconscious, but you won't die. And then that way, like, you can get the guy basically, and that's what happens. And I thought it was very irresponsible of the entire team to portray it like that.
Yeah.
So, what is your take on that?
Yeah. So, I do want to just, in all transparency, I don't frequently watch Pakistani dramas. I did back in the day, but I've lived in Pakistan, so I feel fairly comfortable with my culture. And this episode was really interesting, and I had a lot of thoughts. So the character who attempts, her name is Shifa, which was really
Hmm.
interesting that they picked the name Shifa for
Yes, because
for
she's
someone
clean.
not very healthy herself, right? But
Yeah.
um, I wanted to just start by saying that the character that they choose who tries to commit, or you know, um, it's a like fakes an attempt or whatnot. It seems to me that based on what I was reading about the drama, the few episodes I watched a little bit before and after, she is the villainess, right? She is not
Hmm.
the heroine. She is not the person that we are supposed to be sympathetic towards. It's a very interesting choice then to have her try to commit an act that is considered extremely culturally taboo.
Hmm.
And that's a very I'd say it's a very interesting choice to make, because in when you're depicting anything, right, there's a lot of thought that goes into this. I mean, don't quote me on this, but I believe iPhones, like Apple, will not let their iPhones be used in films if the character is a villain. That you have to use like an Android, because they don't want,
Really?
yeah, don't quote me on it,
Hmm.
but you can look it up. That's what I've
Yeah,
heard.
that's
And
interesting.
I was gonna Google it right before, but then I ran out of time. But that's really right. Like it's in cinema, in television, in entertainment. We people do use things to symbolize and associations. So when you
Yes.
make the villainess the one who has the mental health issues, it's not even portrayed so much as a mental health issue. It's really interesting that they chose that. It's further
Hmm.
reinforces that this is a bad act. It is an act that has a lot of judgment to it. It is not an act that is demonstrating desperateness, that is just demonstrating maybe there's something deeper going on. It's just a manipulation that women use to obtain
Hmm.
their evil aims, right? Which is at this point, I guess, getting stealing someone's husband, right? So right
Yeah.
off the bat, the choice of character that they had to do this. Um, and then as I was watching the scene proceed, Shifa and her mother, they're having this interaction where her mother is saying that, she sent her Rishta picture and she talked to this potential Rishta without asking Shifa's permission, right?
Hmm.
And, why is Shifa not going to school? Why she doesn't want to get married? Why just, what does she want? She doesn't want to do anything. But there was never, it was verbalized more in the sense that, why are you doing this to us? Like
Hmm.
no one ever sat there and be like, Shifa, what's going on with you that you don't you don't have any diljaspi in anything? Like, you don't want to go
Mm-hmm.
to school, you don't want to get married. What's going on? No one approached her with true gentleness. Is there something deeper going on? Are you sad by something? I would be really depressed if the guy I was dating now is married
Yeah.
to someone else and keeps stringing me along, right?
Exactly. Yeah.
Right?
I
Like,
mean, he
but
keeps he keeps calling her and answering her. So
right, but so like
it's,
that's like, wouldn't you be depressed about that? Wouldn't you be really sad about that? Especially in a society where it has gotten a lot better, but where there are a lot of limitations to what a woman can do. If she wants to pursue a
hmm
career, it's usually becoming a doctor, maybe a fashion
yeah.
designer,
Yeah.
maybe an interior designer, but you don't have like project managers or I mean,
CEOs
there's
or
right in Pakistan. And so either
hmm
you pursue a respectable career
yeah.
or you get married, right? So there's
hmm
even so from that perspective, our society will not even ask a woman, you know, are you unhappy with this? Why would you be
hmm
unhappy with this? Because there's no expectation. You're not supposed to be unhappy with this. Like,
Yeah.
this is your lot.
hmm
You should be good. And the truth of the situation is a lot of people are not happy with this. If she wants to pursue education, if she's being forced to do medicine and she doesn't really like medicine, I mean,
Right.
you and I both know medicine's tough,
Oh yeah, for
right? Like,
sure.
what if she
Yeah.
wanted to become a teacher? Well, I don't think many respectable families are going to encourage that,
Or
right?
maybe like she doesn't want to study. She wants to do something else.
She
I
wants to
mean,
do something else, right? That's
graphic
not
designer,
marriage.
like
Yeah,
YouTuber,
that's
TikToker,
yeah, yeah.
whatever.
That's not marriage oriented, right? Like, we don't know at this
Right.
point. Like, mom doesn't know what Shifa is like, what's in her head, right?
hmm
So
Right.
Shifa is just saying, I don't want to get married. And then the whole aspect of it being glossed over that Shifa gets upset that her things are her picture is being sent to people she doesn't know. And so I'm bringing these points up because it's really the way we view mental health is through a very cultural lens in Pakistan, and that lens is very biased against women. It's
Mm.
we have the dual aspect of the stigma of mental health, right? You don't get depressed, you don't have bipolar disorder, you don't have schizophrenia. You need to do more dua, you need to have more gratitude, get some exercise, whatever, right?
Yeah.
Get married.
And
You need to
and
get
and the
married.
biggest thing is, how people just say like, but you're depressed because you're not close to Allah or you're not praying enough.
Yes, yeah, which
Yeah,
is,
that is
I mean, yeah, and I will go into that too. Um, right.
so,
And so there's just the stigma of mental health, and then there's the bias against women, right? Which in
mhm.
this particular episode, you see it played out in so many ways. So then what happens is her brother comes and he's so mad that she's yelling at her mom. I forget what the brother's name is.
I forgot his name too. Shahryar, no. It's
We'll just
Adil
call
Hussain is the actor, but yeah, okay,
Okay,
go
we'll
ahead.
call him Shifa's brother. Shifa's brother. So
Shifa's
he's,
brother, okay.
yeah, so he's furious at her, right? And at the end, he pretty much says to her, which is so interesting. And this is kind of like the misogyny at play, that, shut up and sit down. You're going to meet this guy and you're going to get married. He has effectively not only silenced her, he has weaponized the institution of marriage. At the same
hmm
point, when marriage is the ideal, is what women should be wanting, which a lot of us do want,
Yeah,
understandably so. Who doesn't want a life partner? But
right.
in this instance now, he weaponized it. He is using it as a punishment. And Shifa, you need to come to your senses and be okay with that. Even though, take a step back and be like, if someone says to you, you're going to get married, like, okay, that's not going to make me want to get married. you're,
Right,
you're
yeah,
you're
for
using
sure.
it as something to hold something over me. You're using it as
hmm
a punishment. But because the character is Shifa, the villain, we are not
Yeah,
supposed to sympathize. We are supposed to
exactly.
be,
Yes.
you know what, you didn't shut up, you tried to advocate for yourself, maybe not in the best way by saying, yelling at your mom, but you need to be more like Wafa, right, who is, from my understanding, she got married under some really bad circumstances. But
You're right, yeah.
she's being the good bohu. She's not, she's falling into line. Which, frankly speaking, I don't think that should be idealized. I don't think,
hmm
I think that is. I think in real life, if that were to play out the way that her husband was treating her initially, Wafa would be very depressed.
Yeah, for sure.
Understandably so, right?
I
Like,
mean, she
but
was also married, like, she was manipulated into this marriage,
right.
basically.
But she doesn't seem like she's unhappy. She seems like she's like, okay, this is my lot in life and I'm good.
She
Like
just
smiley
accepts
face.
it.
Right. She doesn't get depressed. She doesn't have any negative emotions about it because she's the heroine, because that is what women are supposed to do. So God
Hmm.
forbid you actually feel bad about your circumstances in life. Right.
Yeah.
Like that's just not cool. And so then it gets weaponized against her. Her popo comes in and, gives her some bad advice. But I will say one thing about, suicide being used as an attention seeking behavior in our culture. We will very much stigmatize that, she just wanted attention, it's a manipulation. Take a few steps back and think, in our culture, what other avenue do women have? Can a woman go to her parents? Can she go to her husband and say, you know what, I'm not feeling good. I don't have, like, I can't concentrate on anything. I don't, like, I've lost the joy in my life. And I
Yeah.
don't know why. I say, yeah, I have children. I have like everything that I want, but there's
Yeah.
just something weighing on me. And most women don't.
If you're not happy with your life, then
Yeah.
you're a bad person.
Yeah, you're a bad
You're wrong.
person.
You're
Right.
right.
Yeah, you can't, there's no avenue for her to go anywhere to like
Mm-hmm.
for a woman, not Shifa specifically, to talk about this. So what is the one thing that they can do? They can do these attention seeking behaviors. In this, it
Yeah.
wasn't attention, well, it was kind of like she's trying to get,
It was, yeah, for
yeah, it
sure.
was an attention seeking behavior, right? Um, and so now, but we're not looking at it as, wow, poor Shifa, she doesn't have a voice. There's like that's the only route that she finds that she can use to get
Right.
some help. We
Well,
see it as like spoiled Shifa, right? Like bad
exactly.
Shifa,
And that's how the writer wants us to perceive it as.
right? Which is,
That's
I
which
mean,
is yeah.
I think anybody who has any like friends in the Pakistani community, in the Desi community, or that there are a lot of people who are struggling. They're struggling silently. And
For sure.
for various reasons, they will not seek help. And this is one of them. This episode did, unfortunately, such a good job of reinforcing all of that stigma. And then, unless you look through it with a very critical lens, you'll fall for it
Hmm.
like hook, line, and sinker,
Yeah. Hmm.
which is really sad. And then when they actually get to the hospital, another, again, somewhat rooted in misogyny, somewhat rooted in the stigma of mental illness, the
Oh my gosh, it
couple.
was really
It was like, so first of all, why is the doctor calling the police and not a psych consult? Psychiatry does exist in Pakistan, right?
yeah.
Someone just attempted suicide and the police are saying, or the doctor is saying, we need to call the police. No, you need to call a psychiatrist and get the girl a psych consult.
That's why I wanted to ask you because I think you worked there, right? As a
Yeah.
psychiatrist. So yeah, so
Well, I didn't work there as
what
a
is available
psychiatrist.
there?
I didn't
No,
work there
not
as
a
a
psychiatrist.
psychiatrist.
Okay.
Yeah, I went to med school there. Honestly,
Okay.
so I mean, in all transparency, I know that there's been a lot more uh, advances made. That there is,
Mm-hmm.
when I was there in med school, it was not great. The psych unit, you didn't have people with depression. You had people with schizophrenia and not a very good understanding of schizophrenia. I knew people who suffered from depression, women who suffered from depression when I lived in Pakistan, and I
Mm-hmm.
talked to several psychiatrists on their behalf. And one psychiatrist told me that the person, this is just not just, but this is depression. The person's not suicidal. The
Right.
person's severely, severely depressed. The psychiatrist at the time said this person needs to be admitted into the psych unit. And I remember I was like, but they're not psychotic. They're not hallucinating. They're not threatening
Societal.
suicide. They're
Yeah.
just really, really depressed.
Mm-hmm.
And then another psychiatrist gave the recommendation to start this patient on a I remember at the time when I was in med school, I didn't know what it was, but I looked it up later and it was a
Yeah.
benzodiazepine. A benzodiazepine. Yeah.
It's addictive.
It's addictive and it's not an antidepressant.
It's not. You
Right.
need
Right.
SSRIs are the
Yeah, right, exactly. But I know that in recent times, I don't want to comment on the current state of what's available in Pakistan because I'm not there. Um,
right.
but I would say, from if this drama is an indicator of anything, maybe not that much. But I've consulted with psychiatrists in Pakistan, like if there was a patient that, or like a friend's sister or something, because that happens all the time. You talk to any psychiatrist or
Mm-hmm.
therapist who's desi, you there the number of times that we get approached on the side, okay, hey, can I just talk to you? I have a brother, sister, my wife, my father is suffering from depression, psychosis, substance misuse. The
Mm-hmm.
number of times that has happened is it's too much. Like it's too much for me to count. And that probably is not a singular experience to me. I'm pretty sure many, many people in the mental
Yeah,
health field would say that that happens all the time. So,
sure.
I mean, I don't want to comment on what's available. I know therapy has
Right.
made some advances in Pakistan. I know even medications have made some advances because I've met people from Pakistan and, they're taking antidepressants. Do they?
Lexapro and things like that.
Yeah, Lexapro is a big one in Pakistan. And then
Yeah.
I want to say in terms of antipsychotics, I've seen a few people on
Mm.
risperidone.
Asparagus,
Um,
yeah.
yeah, so there have been advances made, but the stigma is still there.
Yeah. So
Um,
coming back to the
yeah,
hospital, yeah.
yeah. So then it's like, okay, so first of all, call a psych consult. Hospitalist, what are you doing? Why are
Right.
you calling the
Yeah.
police, right? I mean, maybe it's illegal in Pakistan. I don't, and maybe that's why I should have looked that up. I didn't. Um, but my instinct was just like, why aren't they getting a
Yeah. Yeah,
psychiatrist?
mine too. Like it was just
Right.
odd.
And then so the Popo's intentions were not good when she called her sister. They weren't. But what the Popo was saying, the nature of what
Was
she was saying
correct.
was not wrong. She was saying, why aren't you guys worried? Why aren't you guys asking, why is Shifa stressed out like this? What's
Mm-hmm.
happening internally with Shifa? And the brother, he's getting
He's
upset with
toxic.
he's horrible. Honestly, I was so triggered
And he
by
was
him.
made out to be the hero at the end too, you know?
Right. And that says a lot, right? That's, I mean, in one way, that's subliminal messaging,
Hmm.
like the
Exactly.
associations, right? Um, and so he, says that to the Popo, like you're making a tamasha out of this, and it's a very I think Hassan Minhaj says, "Eh, lo kya kahenge," kind of
Yeah.
thing. Not that
Yes.
my sister almost died,
Mm-mm.
but
Yeah.
my sister almost ruined our reputation.
Yes,
Right.
exactly.
And then, so then if you are a person in Pakistan who suffers from depression and you are watching something like this, is that going to make you want to get help? No, you're just going to, maybe self-flagellate yourself because you're not reading enough namaz. You're not doing dil se dua, you
Mm-hmm.
know,
Yeah.
and you're a bad person if you advocate for yourself that is not in compliance with a socially acceptable way.
Right.
So.
Yeah.
Yeah, so it was I know that was a lot.
Yeah, I know. It
I
was
was
just
taking a lot of notes. So
and it's
yeah.
interesting like how so why did they just make it out, the villain, the villainess, I guess, like is the one making committing, so they just want people to think that it's not good to advocate for yourself, correct? Like
Yeah, or it's not good
that's the
to
messaging.
yeah, it's not good to be unhappy with your circumstances when
Mm-hmm.
they are socially compliant with the cultural standards. Like you should be okay with marrying whoever your parents pick for you, or
Right.
I don't know what her educational goals were, but or going to school and doing whatever your parents want you to do. Why do you have any objection to this? And
Mm-hmm.
if you do, you're wrong. Like, look at Wafa. She had all these bad things happen to her, and she's fine.
Yeah. And then it's interesting because later on in the drama, the parents do introduce her to a guy who she started liking because he was good looking, because they showed him that he was good looking and he's rich, so that's why she fell for him now. And then they do get married, but on the wedding night he tells her that I only married you because my parents wanted me to marry you, and you were just like the second wife. And so she's stuck with him forever now.
So
And
she
that
gets
was the end.
punished because she's the bad
Yeah.
woman, right?
Mm-hmm.
And even
Mm-hmm.
though you think about it, he's good looking and he's rich.
So
That's like
I
half the
mean,
criteria. That's 75% of the criteria
what's wrong
most
with it,
yeah, most parents use for finding a partner for their kids. Like, they're like, we
I
want him to
mean,
be Muslim, and
and
we want him to be
there's
rich,
nothing
and
wrong with it
there's
if
nothing
that's
wrong.
what you
I mean,
want.
if that's yeah, like in especially in the context of our culture, like that's what your parents are looking for. right? And what, so,
Yeah.
but again, it kind of reinforces she is the bad one. And of course, it's the woman, right? So, it, kind of going back to my first point, where the mental health depiction, at least in this drama, is very, it's tied with both stigma and misogyny. And so
Very problematic.
very, oh, so problematic, so problematic. And then, and you watch the drama and you're just like, yeah, Shiva, you deserved it, right?
Yeah, yeah, and
Right.
that is what gets me. Like I get so upset about this. Like I get ticked off.
I know, understandably, yeah. I mean,
I mean, I
it's
like the Puppo. Like Puppo was actually taking a stand for herself, you know?
Yeah,
It's
the
like
football. Yeah, I actually did like the football. I was like, football, you don't need to be calling Khala right now or other football to, I mean, telling, broadcasting Shifa's news. But I mean, what you're saying though is not wrong. You're right.
yeah.
And,
hmm
and Puppo's, I mean, I'm not sure exactly what the Puppo's background was. I think she also got jilted or something.
Yeah, like I
And
mean,
I'm
she
like,
liked someone and that guy did not like her back, and then
and so
things
now
like that.
she's bitter, right? And is
hmm
that
Yeah,
how many Pakistani women do you know in real life are bitter? There's a lot. There's a lot. I mean, and, no, and it's not to make fun of
yeah.
them. It's
Yeah, I
sad,
know. Yeah,
right?
it's
Like
sad. Yeah.
we know like aunties and women who are very unhappy with what life has handed them, what they felt that they had to do. But in the dramas, those women are not, those women would not be depicted as sympathetic. They'd be like the
hmm
pupil, right?
Right.
Like
Yeah.
not
The-
nice, unkind, manipulative,
hmm
bitter in a bad way,
Yeah.
not bitter in a let's understand where you got to this point.
So
But
so how can dramas change all this?
I mean,
And do and are people affected by it? Like, when they see this? Like what is
I
the
don't
effect on people?
I don't think, people are and this is my opinion. This is not, I wouldn't say it's based in,
Hmm
um I don't it's kind of like that subliminal thing, that whole you start associating iPhones with the good people and not with the villains.
Yeah.
It's more subliminal. I don't think you it just kind of subliminally reinforces suicide is what manipulative women do. You should always listen. Your parents are never wrong. You should not have any desires beyond doing what your parents say. And if a guy screws you over, well, first of all, why were you dating that guy? You were the bad person because you were even talking to a guy before marriage, right?
hmm
It just reinforces, I think, subconsciously speaking.
Subconsciously, yes.
Yeah, subconsciously. So I don't think a person, well, maybe like necessarily is watching this and is thinking, oh, I'm depressed. Because honestly, I don't even know how much education there is to the Pakistani public about depression. How do you recognize
hmm
depression in a community where it's not talked about? And it's not going to look like the same in a Western woman, like a person who might come into my practice, like, I'm not eating, I'm not concentrating, I'm not, I can't
Yeah.
get up. Most Pakistani women, I would say, they keep on, they're doing actually everything. They're taking care of their
Yeah.
kids, they're cooking, they're cleaning, they're watching, they're taking care of their husbands. They're not sitting there crying all day. It's more of an inner sense of unhappiness, right, which
hmm
can manifest itself in jealousy, bitter comments,
Yes.
like
Jealousy.
tane to other people, like being
Exactly. That's what it
right,
is.
right, like making these like kind of like, oh, auntie, you are not nice today, right? But then it's like
तुम्हारी शादी हो गई, when are you
yeah,
gonna be
right,
like, but like things like that.
right,
Yeah.
things like that. But and no, and the thing is, because they're so negative, it's like no one takes a step back and being and kind of like, well, auntie, why are you like this? Why are you so unhappy? Why are you
hmm
always comparing yourself to others, or why are you up in everyone's business? Because we just kind of like, oh, auntie's just not a nice person, but
Yeah.
that's how I feel that it manifests in our community. Um, a lot of, I would say, bitterness and jealousy towards others because we're not reflecting inwards, right? Because the
hmm
depression is not going to manifest itself the same way that it would in a Western population.
Okay.
And I mean, even in the West,
That's
there's still a huge
interesting.
stigma, right? Because
Right.
I
Yeah.
don't, I would say most Pakistani women stay pretty functional.
And then can Pakistani dramas change the way they portray all this?
I mean, if they wanted to, they could, right?
And is that helpful? Will that be helpful?
I
That's
think
the
it
other
would be very
question.
helpful. I think it would be very helpful. I think you'd have to do it very, cautiously. You cannot hit people over the head with,
Yeah.
something that would be perceived as modern or liberal.
Mm-hmm.
Um,
Mm-hmm.
I think that would just be like, oh, depression is a Western thing. बिगड़े हुए लोग
Right.
हैं.
Yeah.
कोई काम नहीं है इसलिए ना,
Like mhm,
you, you know,
with subtlety, I
with
guess.
subtlety, right? Like you could maybe show Wafa not being 100% unhappy with her lot in life, maybe being a little upset, or you could even just show someone like Shifa a little bit more nuanced, you
Right.
know, just have
And
a little bit of more
make the audience sympathize with her.
and make
Like,
the audience sympathize with her, go into the what I don't think it's morally gray, but the audience might think it's a morally gray character because she's
right,
not,
yes.
she's coveting somebody else, even though he's leading her on,
Mm-hmm.
and that's who she thought she was going to marry,
Okay. And then I guess we can move on to Behrupia.
yeah, yeah.
Did you watch it?
So I watched like the first two episodes.
Mm-hmm.
Um, I'll be honest, that surprised me. Um,
Okay.
you know, a dissociative identity disorder. I don't know if you want to tell the people like what Behrupia is about or
So
uh
Behrupi is a new drama that just started a couple weeks ago. It's written by Rida Bilal and features Faisal Qureshi, who's been there for a while, and then Madiha Imam. And Faisal Qureshi is shown to have dissociative identity disorder, which is also called the multiple personality disorder, because he's had childhood trauma. So
yeah.
basically, that's what it's about.
Yes.
So,
So
what do you
when you
think
a-
about that?
yeah, so when you asked me about this, like, my instinctive reaction, because I did my training a long time ago, was, oh my
Yes,
God,
yes.
are you kidding? I don't even know if this, like, because for a long time in the psychiatry community, psychology community, DID
It was
was a very, like, does this diagnosis exist? So I did a little bit of
controversial
research.
too.
It was controversial, right? And so I would say that the consensus now is that it does exist.
Mm-hmm.
It is still rare. The statistics I was reading was that it has about a 1% prevalency rate, which is about the same as schizophrenia. In clinical practice, when I talked to some of my peers about this, that's not what we're seeing. You definitely see a lot more. I've never seen, and I've been practicing, like, if you count residency, for about 20 years now.
Yeah.
Um, I've never had a patient with DID.
I did see
Schizophrenia.
like a case report in South Korea that they had reported in
Hmm.
2000, I think maybe 2022 or 2023. It was in the Journal of Psychiatry that I did see. Like
Oh,
there was just one case report. Yeah. Like,
yeah. I mean, no, and
so,
like when I was kind of looking stuff up, like at least in America, there have been cases.
mm-hmm,
And so
mm-hmm.
the diagnosis does carry more validity than I think maybe 20, 30 years ago it did, because there's been more research, but it's still not a very well understood condition. Um, so in terms of the way they reference, so I guess one criticism I would have is, why did you pick DID of all things to portray? I think that's more for entertainment purposes, because if you're trying to make a comment about mental health in Pakistan, pick something that's a little bit more common, something that's a little bit more prevalent. Like if they had decided to showcase schizophrenia, that would make more sense to me. But, DID is a very it has a lot of entertainment pull. Like, we have in the West, we had Split. I don't know if you saw that movie,
Yeah. Mm-hmm.
right? Like it is a very it's the more fascinating kind
That's
of
yes.
condition,
And then
right?
you've got this one actor playing nine roles, so that also
Right.
brings the audience, right?
Right. Like that's a juicy role for an actor, right? And
Yeah.
so
Mm-hmm.
so I guess, from that mental health perspective, that would not be, if you were advocating for better mental health representation through an entertainment media like Pakistani dramas, I would not say start with DID. If you want something
Um,
for entertainment purposes, okay, fine. I get you pick
Yeah,
DID,
I mean,
right?
I think the writer said that she wanted to like portray about or discuss about the child abuse.
Then you could
Yeah,
have given the person PTSD. You could have given
PTSD. Yeah,
them, yeah, you could have
mhm.
given them major depression, right?
Even with psychosis,
With
that's
psychosis, yeah, you can give
right.
them major
Yeah.
depression with psychotic features. There's still a lot of other ways you could have gone with a traumatic background, and I think it's a little disingenuous to not admit that you might have picked this because it does have entertainment value, which is fine. I mean, you want people, I
Hmm.
get it. Like you want people to watch the drama,
Right. Oh
that they're,
yeah. Hmm.
but then, but if you're going to say, I really wanted to bring, light to mental health through dramas,
Okay,
okay, yeah, you
that's
did, but
not
you also picked something that's not as common. and maybe might not as resonate as much with the Pakistani community or with any community, frankly speaking. It's not that common. But I would say
Right.
I was surprised, like after I did my research, that it wasn't poorly represented in the drama. I mean,
Mm-hmm.
there were some glaring mistakes. When he sees an altar, like it's at the work meeting, and
Yeah.
he splits, I guess. I'm not sure what was going on, if he sees an altar or he was hallucinating, and his assistant comes and gives him medication and it goes away immediately. Yeah, that's not how that works, right? Like, just
Yeah.
from a physiological perspective, that's not, you don't give someone a medicine and their hallucination vanishes
Mm-hmm.
right like that.
Right.
But in terms of what, it being rooted in trauma, very true. The person, um, traditionally DID has been associated, you would think that the alters don't really have an awareness of each other,
They do
um,
sometimes, right?
but sometimes they do, right? And so that's what
Mm.
they were showing more. Alters are protective, they are meant to, protect from a trauma response. And they were bringing about the mental health conference, uh, and they
Oh
were
yeah,
talking about,
yeah.
yeah, they were
That was
talking about,
good. That was good,
that
I
was
think.
good. Yeah, they were talking about integration. So if I was pleasantly surprised. I
Yeah.
was going into it thinking, oh my God, this is, and I do think that there were some, some things they missed. I mean, but still not bad, to be honest with you. Um,
Mm-hmm.
I wouldn't have chosen it, but that's,
Yeah.
but for entertainment purposes, yeah, not bad. Mhm.
Not bad. Okay.
Yeah,
Hmm.
I mean, given how much we know about DID, right?
Yes, exactly. And like
Right.
we don't even have like treatments, I guess, like
I
except for
mean, like,
therapy.
yeah, therapy, like the role of medication. That's where I was kind of like, why are they giving him, like, if
What
he's, I don't know what medicine they gave him. And I don't know if he was hallucinating or seeing an alter, but no medicine is going to kick in
anxiety, like that's the only thing you can think
for
of.
anxiety. Yeah, but he wasn't,
Right.
like, he was seeing something, right? So if they gave him an antipsychotic, it's not going to work within seconds. And that's
No, no,
kind of
no.
how it, like, if it was an anxiety response, he would be having more of a panic attack. That's where if you were going to give him something short acting to
You're right. It's
relax
like
him,
yeah, yeah.
right?
Hmm.
So there, I was kind of like, "Oh, well, that's not how medicine works," but
Yeah.
okay, that's fine. I mean, so
Yeah.
yeah, honestly, I had a lot more issues with Gav, to be honest.
Oh my, Rare was just really,
That
I mean,
was
it was toxic.
that
Like,
was that was a hard watch. That was a hard watch.
yes. And I don't know if you remember, like in Hamsafar, I know you've watched that one.
Yeah.
And then Sarah will come at the end. I don't know if you remember that.
What,
um,
what character was that? Was that
she was the other girl.
the one that liked him?
Yes, yes.
Yeah, yeah, yeah. See that? Yeah, like, you
Same
know,
thing. And then
same
the
thing.
mom becomes crazy at the end.
She was mean to the.
Khidr, whatever.
Yeah, yeah.
Khidr, I think that I don't. What was her name? I don't know. I forgot something like that. Anyways, yeah, the girl Mahira Khan. Like,
Mayra
yeah, she
Khan,
was. And
yeah,
then they just make her crazy at the end.
yeah,
Just
yeah.
she'll just
It's
like
just the, again, kind of like punitive in nature, right?
right, yeah. So that was that was a good discussion. Do you
Okay,
have any final thoughts? Like,
you know, I just, I mean, you gave me this, you invited me to this platform. I really appreciate that. That's very kind of you. And I think anything that brings light to mental health, especially in our community, is so, it's wonderful, it's needed. We're Muslim. There's also, we've got the Pakistani cultural aspect, and then we've got the Islamic aspect,
Islamic
and
aspect, yes.
right, which they didn't really touch upon the Islamic aspect, but like no one actually, I think, in Nigeria said you should read namaz more. But for people who do take that perspective, that read namaz and whatnot, remember, mental illness is rooted in biology also. It is rooted in environment. It's a biopsychosocial. There's a lot of things going on in it. But, as Muslims, we're told to take care of ourselves. And mentally is the mental impacts the physical,
Right.
So, whenever I talk to, my Desi patients or my Muslim patients, and they're like, they say to me, I feel like I'm a bad Muslim. I always say, remember, Huzur Pak, peace be upon him, said, like, tie your camel,
Right.
pray,
Yes.
but tie your camel. So yes, turn to Allah, pray. I encourage that. It's good for your soul.
Mm-hmm.
But it
Mm-hmm.
doesn't mean that you can't also seek help. In fact,
Right.
for me personally, maybe not for other people, for me, it is a duty to take care of yourself. And it
Yes, it is in
in that
Islam. Yes.
in
Mm-hmm.
Islam, right? Like you are actually following what Allah would want for you. So I guess
Right.
that would
And then
be,
yeah, like and even in the Sira we see that some people who had migrated from Mecca to Medina, there was a Sahabi who actually tried to kill himself. Like they were really depressed when they first came from Mecca to Medina. Because the whole environment and the weather and
yeah,
everything was so different, right?
yeah,
And one of the Sahabi actually like tried to kill himself. He cut his wrist. And because of that, he did die. And then later on, like people would ask our prophet, like, what happened to him because he committed suicide. And then the prophet ﷺ said, like, Allah did put him in Jannah, like even though like his hand was not in Jannah, but he was in Jannah.
yeah,
So because so it doesn't, so that's where our religion stands too. Like
yeah,
Allah knows, right? Like because I know like some people will say, like, will feel bad about themselves, like they were even having these suicidal
yeah.
thoughts,
Yeah, and so and then they're less likely to reach out for help. And actually, I've used the terminology commit, and I do want to make a point of correcting that, and it very much aligns more with the Islamic perspective. People don't commit; they die by, you know,
Yes.
it is not to be perceived as a choice they made. It is to be perceived as this is the ultimate failure of treatment for this condition, right? Like
Yes.
people,
Hmm.
people die from cancer, people die from diabetic
Right.
complications. They could be taking the treatment and sometimes they're still going to die. And,
Hmm.
so some people, unfortunately, they might be seeing a therapist, they might be taking meds, and they still will die by
Yes. They
suicide,
will.
right?
Yes. Hmm.
Yeah,
Hmm.
right. So it is the unfortunate consequence of a medical process at the end of the day, of a psychiatric
Correct.
process,
Yes.
right? A
Hmm.
failure of treatment. And I think people kind of get that confused because we'll say, well, I hope he's in peace now, like emotionally speaking. Well, we also say that, about somebody who has dementia, or,
Hmm.
somebody who's
Yeah.
suffering
Hmm.
from severe diabetes. Like I hope, like he's out of his pain. But that doesn't mean that it wasn't ultimately a lack of, it was an ultimately treatment failure. So, I mean, I wanted to correct myself too, because I keep saying commit, but it is die by
Yeah.
suicide. And
Dive to
when,
dive. Okay.
right.
That's
And when you
interesting.
said,
Yes.
that you shared that story, that person died by suicide,
Yes. Hmm.
and so, and I think it's very, like, it just,
Terminology matter. It's like how you talk about things. So
right.
that
Yeah.
matters too.
And I
Right.
think it's so, and it aligns so well with our faith, right? Like
Right.
that's
Exactly.
how I
Hmm. Hmm.
feel we are supposed to perceive it as.
Right. Yes. So that is it from our side for now, at least. I don't know, Dr. Huma Qureshi. I hope you'll join us again.
Oh yeah, no,
Maybe,
this is
maybe,
yeah.
maybe I'll talk to you about some other dramas that I come
Oh
up
yeah,
with
yeah.
or
You
that I
give me the
watch, and
assignment and I'll do my research. Yeah,
inshallah.
no, I appreciate you giving me
So
this platform. It's very kind of you.
thank you so much. All right.
Oh, thank you.
Well, I see you guys later. Allah Hafiz.
I love this.
Bye.
Bye.
Bye.